Welcome. This is Bill Berkowitz, the Ideal Protein Regional Development Consultant for Central and Northern California. Over the next few minutes, listen as Dr. Tim Logemann, a medical director at Aspirus Clinics in Wisconsin, shares 1. Their initial evaluation of and consideration in bringing the Ideal Protein protocol into their system, 2. Their initial pilot group trial outcomes, and 3. Their ongoing experience, results, and the growth of the program, noting that it has all been word of mouth. Dr. Logemann shares some of the unexpected benefits of the Ideal Protein protocol, such as the anti-inflammatory effects and the marked reduction in the need for medications. Lastly, you will hear Dr. Logemann discuss how the Ideal Protein program is consistent with population health initiatives and supports triple aim outcomes.
My name is Tim Logemann. I'm a medical director inside Aspirus Clinics up here in Wausau, Wisconsin. A little bit about our system. We're a 5-hospital, 300 to 400 physician system, mainly primary care, but also some affiliated specialists. We cover a couple 100-mile area up here in northern and central Wisconsin. The idea here today is just to go over our journey as we started and developed an Ideal Protein program. I discussed this program with my partners and our nurse manager to try to get some buy-in. I think the two breakthroughs came when we had our nurse manager call other programs and get great reviews. There was certainly some skepticism about cardiologists going into the diet business, trying to decide if that really was our mission or not. When we realized all our patients that are struggling with obesity and all the medications that leads to and the unaddressed risk factors, we really did accept that as part of our mission, and especially when we were able to talk to other Ideal Protein programs and hear about the great results they were getting. We got my partners and the system leadership and the staff to agree to a pilot trial to see if we would like that. We decided we'd track our results and report back to our leadership and management and our other physicians to decide whether or not we would move forward. This is from all of our pilot. We did have a substantial decrease in BMI. We had a substantial decrease in blood pressure, nice drop in cholesterol, HDL, LDL, very nice drop in triglycerides as well. So based on the results of the pilot data, the clinical results, the patient satisfaction, and the fact that we really felt we were addressing and improving some risk factors, we elected to go ahead. We're now averaging about 340 patients a week. We have 3 workshops every month where we do intakes. In March of this year, we took in 60 new participants. So far, we have not advertised at all. There's no advertising budget at all inside this program. It's all been word of mouth growth. We've had a total of 600 participants. We've lost over 10,000 pounds. It's very reproducible in that women lose 2 to 3 pounds per week, men lose 4 to 5 pounds per week. We've had treated a lot of the senior leaders inside of our system and the board members. We've lost a total of 262 pounds there. In March, our gross revenues were $100,000, so we're looking for, again, a better cost margin as we go forward. The program is more profitable as we expand because you add patients to an infrastructure that you have to keep with inventory. Some of the things that we've learned in developing this is that there are many skeptics as you go into the weight loss business. People wonder about whether that should be the mission or should that be left up to the dietitians. Some of the dietitians wonder about a low-carb diet. So there can be a lot of skeptics in the beginning. I think it's very important to start with a pilot trial if you have any concerns so that people can see the benefit for themselves. You do need support of your partners, your administration, and the staff inside your office. And I do think it's helpful to have a system to manage the patients and their medications where you can taper medicines as they need to be tapered. And it's interesting, the overweight population will be very varied. We have people that need to lose 20 to 30 pounds, and we have people that need to lose 150 pounds. So obviously the health needs of those people are going to be substantially different. Some people are trying to get ready for their high school reunion or a wedding, and other people have severe problems from their obesity, joint problems, diabetes, hypertension, sleep apneas. There is some unexpected benefits that we think in this low-carb diet. We think the high-carb diet is probably pro-inflammatory. This lowers the inflammatory markers, so we've seen substantial improvements in asthma. I've come off all my asthma inhalers. We see substantial improvements in gastroesophageal reflux disease. One of our patients was on 17 medications, and he was able to discontinue 5 and reduce 3. We did a survey on our patients. 33% kept off 100%. This is at about the 3 to 4 month mark. 44% kept off 90%, so 75% of our patients, at least at the 3 to 4 month mark, have kept off most of their weight. 87% of the patients would recommend this program to families and friends, which I think is also a very important statistic. The nice thing about this program is that it is consistent with population health initiatives. We're stopping all kinds of medications. We're getting people moving. We're getting people feel better. It addresses some of the underlying causes of cardiovascular disease as opposed to just getting them a medicine for the problem. We're actually addressing the underlying problem. Of course, it supports the triple aim of decreased cost, improve outcomes, and improve patient experience. 98 participants were on medications. 127 of their medications were either reduced or stopped. We stopped most diuretics within the first week or two because the diet is so low carb that the insulin levels come down and people have a tremendous weight loss. Most of the medications after the diuretics then are going to be the antihypertensives and of course the oral hypoglycemics. We have not had a lot of type 2s on insulin, but most of those are either going to stop or come off their insulin completely as well. So we're seeing tremendous amounts of medications being stopped. The growth potential is tremendous. This is a fun thing to do. People love you when you help them lose weight. Everybody knows they need to lose weight. Everybody's trying to lose weight, and when you can actually provide a solution that works for them, they will come and seek you out and they will thank you. In our town, it's been referred to as a Logemann diet occasionally. I've gotten 4 hugs out of the diet so far. I never did get a hug for a rotablator atherectomy or stent or an acute infarct intervention, but helping people lose weight, they're stopping you in the hall, they're thanking you, they're giving you hugs. It's a lot of fun to bring something like this in. Overall, it's been a great program for us. We've really enjoyed the experience. We're seeing people happy. We're giving them their life back so that they can get back out and be active and enjoy life. They're coming off medications. It's been fiscally reasonable for us as well, and we really encourage people to give it a chance and give it a thought and consider participating.
As you've heard, the Ideal Protein Protocol delivers clinical outcomes that are predictable, repeatable, and measurable. The next step, as we've done with our 4,000 plus providers, is to schedule a 20-minute exploratory teleconference call. In order to do that, contact me. My phone number is 805-305-0884, and my email is wberkowitz@idealprotein.com. I look forward to speaking with you.